Hello everyone and welcome to the Narcissistic Abuse Recovery Care Network. I'm Dean, the host of the N.A.R.C.N network and channel, and also the host of the Unmasking the Narcissist channel. Today I'm going to be presenting to all of you episode 119, and the title of episode 119 is The Difference Between Bipolar Disorder and Histrionic Personality Disorder, and how these interrelate to each other within the confines of NPD. So this is basically part 2 of episode 119, and in this part we're going to be just discussing and focusing on the bipolar disorder or borderline disorder aspects. So let's get right into it here. Here are some of the DSM-5 criteria for borderline personality disorder or bipolar disorder. Patterns of unstable interpersonal relationships and/or friendships or intimate relationships. These are exactly the same as narcissism or NPD criteria. Number 2, identity disturbances, unstable image of the self-identity. Number 3, impulsive behavior, example, substance abuse, sex addiction, recklessness, dangerous behavior. All the same criteria, again, as narcissistic disorder behavior, or NPD disorder. Inappropriate anger, difficulty controlling anger or controlling feelings, again, the same as NPD disorder. Anxiety, again, a high-level element in NPD disorder. Emotional instability, and a few other particular things work themselves into the criteria here as well, too. So we're going to just make some points here using the American Psychiatry's DSM-5 scale as a reference for some of these points. According to the American Psychiatry Standards and Assessment Criteria, borderline disorder or bipolar disorder is more often than not a misdiagnosis of mid-level narcissism. This is being demonstrated and recognized more often and more in modern psychology science due to better assessment from psychology professionals. Although this still escapes the scrutiny of professional assessment a large majority of the time due to the hidden nature of the narcissist state of being. Most women are found or diagnosed to have bipolar or borderline disorder when they are in fact truly mid-range narcissists that have clinically diagnosable NPD disorder. Sadly, the material, sadly, maternal and empathic and caring nature of females the way females present becomes a problem in actual diagnosing of both bipolar disorder and histrionic disorder patients as having narcissistic disorder, which is what their true diagnosis actually often is. It is far less stigmatizing to view a female as a borderline or a person with bipolar disorder than it is to be labeled a narcissist or to have NPD disorder. But that is what they are. Males are much less likely to be hated as much as a narcissist if they are tagged as being a narcissist. But it is also strangely more acceptable for a male to present as a narcissist as opposed to a female, according to the DSM-5. It's almost considered acceptable for a male to be considered a narcissist because of the gender bias that represents males as ruthless or go-getters or headstrong or brash individuals, and therefore acting narcissistically as a male is thought to be much more acceptable than it is to be this way if you're a female. But we know female narcissists can be just as rash and have some of exactly the same behaviors as males in these extreme times. Unfortunately, if you look at the DSM-5 criteria into this, it doesn't actually state within the DSM-5 criteria anything about this being the case. But this is actually the case, and modern psychologists are learning more and more and more about this, and starting to see that this is more and more and more the example of what's really going on here. Females are being misdiagnosed very readily who have narcissistic personality disorder and who have narcissism issues, and they're being tagged as having histrionic personality disorder or bipolar personality disorder or as being borderlines. And this is not what's actually going on with them, because people in professional psychiatry, especially if they are psychiatrists or therapists who are female, they do not like to tag women as being an individual who has narcissistic personality disorder. It's shied away from in psychology. Female and male narcissists are actually about 50-50 as far as prevalence for narcissistic personality disorder, but females are harder to diagnose because more of them are usually mid to lesser level narcissists than males are. So often therapists and mental health professionals misdiagnose females with having NPD and misdiagnose it as being something else like BPD or HPD or some of the other disorders that we have also mentioned in other N.A.R.C.N episodes. So this is part 2 of episode 119. This was focusing on BPD and borderline and how that relates to narcissistic personality disorder. And we're going to go into part 3 here after this video and talk a little bit about the HPD focus, which is histrionic personality disorder, and we'll talk a little bit in part 3 of this in that upcoming episode here. So I'm going to say to you guys, please stay tuned. That episode is going to be coming up really shortly, and I hope you guys have a great day. I'll catch you in that new episode.